2004, they denied payment to the hospital where I had my cancer surgery at. I'm 22 years old. I was diagnosed with cervical cancer. I went in, had surgery, called the LEAP surgery, very simple procedure. 2 weeks later, Blue Cross Blue Shield through General Motors sent me a letter saying they were denying payment to the hospital for the surgery because that type of surgery is only recommended on women that are 26 years of age and older. 2 weeks later after that, I got a bill for close to $8,000. 22, I was a mother. My daughter was just a year old. I was working on my master's degree, and I was working 2 jobs. Where was I supposed to get $8,000? Now, 2 weeks ago, I went into the emergency room. I don't have insurance. I've been out of work since December. My husband lost his job back in January. I went in thinking I had an appendicitis, and it turns out I have ovarian cancer. And I'm 10 grand in the hole right now from those 2 days in the hospital. So I'm trying to get on Medicaid so I can have the surgery, and they want to do surgery as quickly as possible. But again, they're looking at our income, saying if we're going to be eligible or not. Where does it end? Where does this end? You have to stop denying people. If we're going to keep the insurance company
that we want the administration to hear, because this is why we're in the urgent moment, right? I mean, you don't have time to wait. You need to be covered, and you should not, none of us should be in a position where people we love or ourselves are denied coverage. That should not be the question that's asked. So, thank you for having the courage to come and share that story. And I'm wondering if there are others in the audience who have a similar story.
I want to know who in this room is going to help this woman.
Yeah, right.
Right.
All right. One of the champions in Michigan for covering the uninsured.
I'm mad.
Go, Bill.
Who in this room is going to help her? You going to?
Absolutely.
All right. Mr. Locke, come on, let's step forward. People are dying. And they are suffering because they do not have access to health care. And this is, we've heard it said this is a moral imperative. You just heard why it's a moral imperative, and we've got to do something about it. I am Sister Mary Ellen Howard. I run Cabrini Clinic at Most Holy Trinity Church. It's the oldest free clinic in the United States. And I am a graduate of the University of Wisconsin at Madison. Here to this meeting. When I came here to this meeting, I walked through our waiting room where probably 50 people, 50 uninsured people were waiting for free care at Cabrini Clinic. I came here on their behalf. We've got to do something to help them. This is, it's unconscionable, it's criminal. Something's got to be done. It's got to be done now.
Thank you for coming on.
All I would say is come to Detroit, because at the Detroit Medical Center, we'll take care of you. And if you'll talk to us afterwards. What's that?
We've already got some help. We've given our card to help the police.
That's great.
You're coming to DMC. Thank you.
Talk about, though, people coming to the Detroit Medical Center without insurance and what that means for hospitals and why we need to get this fixed.
Well, the system is crazy. I mean, the whole system. And the Detroit Medical Center, and I run the DMC, between 20 and 25% of all patients seen on Medicaid in the state of Michigan are seen at our hospitals. 3/4 of the hospitals in Detroit have closed in the last 2 decades. We still have 4 that are operating, and it's because of the incentives and disincentives in this country that make it much more profitable to operate in growing areas and less profitable in our places. Not that people in Detroit have less need for care. We're responding to incentives. And so I think the direction that you're going is great. I think a lot of things have to be done to control the cost. Basic costs make no sense to me in the way incentives are done. But if you think in terms of jobs, you talk about job creation. Don't we want jobs to be created in the areas of highest unemployment? But the system we've set up is causing places across the country to close down jobs in your urban areas and move them to other places. Everything about this healthcare system is backwards, and I hope the President will start over from scratch.
We need it fixed. I gotta turn this back over to Jim, but I know he's gonna talk to people who have stories, just like, what was your name? Adrienne? Adrienne, all right, Adrienne, thank you.
You know, part of Adrienne's story is something we've grappled with in Wisconsin, I know you have in Michigan, which is obviously the denial of coverage is an issue, but it is people who are just above limits. And you know, we have worked hard in our state to keep expanding the limit at which our basic Medicaid program, Badger Care, and we're a state like Michigan that has moved it up to 200 and then 250% of the federal poverty, but that is still a very low income.